I had been undertaking a leadership course, so as part of that I had a formal 360 degree, and I approached quite a wide variety of people. So obviously my own team, my direct line manager, some colleagues and peers, but also some other people who I worked with but not directly, and also people in other organisations. So I had quite a lot of feedback, and I had a formal report which I could use to actually reflect on and think about how I can improve, you know, my behaviours and performance in certain areas. So that was very valuable. I think going forward, having given it some consideration, because I do a lot of meetings with families, I think I will use that as feedback, because often I will get feedback from the family. And sometimes, you know, it's not always positive, and that's always valuable. Sometimes it's very positive, but also feedback from colleagues who sit in the meetings, and we will have a debrief after the meeting, and then we will have feedback about how we feel it went, you know, how people behaved in the meetings, etc. And I think that will be really quite useful, because that's very relevant to my role and very relevant to how I improve going forward. I'm not in a nursing team. I am actually part of the medical directorate. That was quite a challenge, and I was unsure quite who I should approach. So I actually sought advice from the nurse director, because she's my professional lead. Yes. And she guided me, and in fact it was Lynn who did my discussion, and that was really helpful. So I would say if people aren't sure, then you can always seek advice. Yes. You know, if you are unclear, because I don't have a senior nurse above me in my structure, so for me there wasn't anyone obvious. Yeah. But obviously another registrant who's senior, it was absolutely fine, and it worked really well. I think from my point of view, because as I say, I'm not directly delivering face-to-face care, the discussion was very helpful, and looking through the portfolio was very helpful in reassuring me that I was using my nursing knowledge and skills on an almost daily basis. And actually that was quite pleasing, because when you step out of a hands-on care, you do worry about your registration, and I think it was very good. You know, I met with Lynn and we had a very good discussion, and that for me, because I don't directly report to a nurse, for me was very, very helpful. So I'd say for others, you know, not to be frightened by that. If you aren't in a direct care delivery role, that you can demonstrate that you're using those skills and that knowledge in different ways.